By the end of high school, it is estimated that nearly 2/3 of high school graduates have participated in or are participating in sexual activities, as reported by Naomi Starkman. Due to this, sexual education is taught in public schools so as to reduce the unsafe methods of sex. The common question, however, comes to how to teach these methods to youth. It will be found that the two main forms of teaching sex, although their positive merits, lack in their general effect and require reform to become better. For background, the current and prevalent forms of sex education arise in abstinence-based education and comprehensive-based education. According to the Heritage Foundation, abstinence-based sex education, in theory, is good for the physical and psycho-emotional well-being of youth. If followed, it allows for STDs and HIV to be avoided while avoiding unwanted pregnancies. It also decreases the amount of one-night stands, allowing for more healthy relationships to arise that are more about the emotional well-being of each other. Comprehensive sexual education, then, is still about abstinence, but it provides more means, such as contraception, to be safe. This, as reported by Naomi Starkman, helps the contraceptive use increase in both premarital and marital sex activities and allows for the teaching of STDs and HIV into more depth. This allows for children to be more safe if they choose not to abstain and gives the child a choice to abstain or not and still be safe with a little bit more risk in participating in sexual activities. Giving a child a choice is always a better instance of forcing them to do something, as if they are forced to do something, they tend to not want to do that. Despite these positive aspects, sexual education reform is still needed due to the constant bickering about which form should be used and that their general effects are lacking in what they need to be doing. The Guttmacher Institute, an institute focused solely on the reproductive health of individuals, studied the federal money being funded to federal programs of abstinence-based education and comprehensive-based. It found that with each president, the money fluctuated in millions of dollars, during the Clinton administration it was roughly $60 million, to the Bush administration to $100 million, both of them being for abstinence. And then under the Obama administration, comprehensive-based education went up to $180 million, with abstinence going down to $60 million roughly. This means that it's becoming more and more about politics and less about the actual safety of youth. The safety of youth should always be prioritized over the politics in play in the White House, and aspects of sexual education should be set so as to avoid confusion between two individuals in a relationship and allows for less confusion across the generations receiving these educations. Both types then, as Christy Walcott describes after analyzing a national survey, are not reliably increasing the use of contraceptives and the behaviors such as abstinence to avoid STD, HIV, and unwanted pregnancies. This means that they're not generally achieving their goals that they want to achieve, and means that more time is being wasted arguing between the two sides than actually helping youth in these situations, meaning that as each day goes by, more and more youth are participating in unsafe sexual activities and transferring more STDs and HIV. For these reasons, reform is needed, but how could that be done? To quote Walcott, the success of currently valid sexual education programs may rest on the systematic delivery of theory-based curriculum, sufficient duration and intensity, presented with clear goals and messages using established teaching practices. This means that more time can be used to ask questions and answer those questions so as to go more depth into what sex is and how to be safe during it. It allows for a set education to be established, meaning that less miscommunication can happen in a relationship between two individuals and more unsafe sex practices can occur easily. Walcott then goes on to say that peer negotiation should be an essential part of the curriculum, as it can help individuals address situations that could lead to unsafe sex. It gives practice to these youth so as to be safer when they're in these activities and to think that they can use contraceptives and know how to bring that topic about in that relationship. These methods above, if implemented, should be implemented so as to help youth be more safe in their sexual practices and help miscommunications be decreased. Given these points, the current methods, despite their appeals, are not working as intended. At the current state, STDs could continue to spread to youth unknowingly, yet this could and should be changed so as to prevent this. There will always be cases of premarital sex and marital sex that are unsafe in their nature. Both proper education and teaching practices and number of these occurrences should be able to decrease with education starting at a young age of when they're starting their adolescent life. With this, hopefully HIV and STD transmission could be reduced and more education can be received about how they're transferred. Unwanted pregnancies then can also be decreased with this type of education format. Thank you.